Hey everybody, I just wanted to point out something. I just finished doing a case where I moved an old set of Saline implants, about 20 years old. Patient did notice one side was getting a little smaller than the other. So when people say to me, why don't you like Saline implants over silicone, because I do have a preference, well, this kind of exemplifies it. Even though you can kind of tell when the one side goes bad, if we look at the two implants that came out, this came out of the left side, this came out of the right side. Clearly they look different. This is overfilled, this has been leaking. But one of the things you'll notice is I kind of squeeze, you can kind of see fluid coming out. So this is a valve failure. And the valve is the part that we fill. This little plug goes in there. Let me see if this will come out. I may not. It's stuck in there, but it's leaking around it. So this is the problem. On a silicone implant, they're pre-filled. There's no valve to fail, so you have one less system that can go bad. So this is an example of just kind of why this implant and where it is. And it's a slow leak. You can see how hard I have to kind of push. So probably for this patient, when she's laying on her stomach, like when she's sleeping, the fluid comes out, but when she's just on her back or just the day-to-day stuff, it's not leaking out. So that's kind of a cool example of kind of when these go bad, what they look like.